Welcome to Attempting Class, and thank you for joining the channel. This series, number 5, test taking strategy, focusing on key concept, keywords in questions, how to identify them, how to break down the question to be able to figure out what the examiner is asking you, and use the concept to answer the question. 5 questions, very straightforward, but it's all based on keywords. Let's continue. This is the first question. Straightforward, right? A nurse is caring for a client on what? Olanzapine for 8 weeks. Client reports inner feeling of what? Restlessness. Which of the following medication the nurse should anticipate? I've underlined the buzzword, I call it, which is the same as the keyword. 3 things I've underlined. Then you break down the question. What is the ask of the question? Anticipate it. That means you expect something, right? That the doctor will provide. What is the case for the question? Patient is on Olanzapine for 8 weeks. And what is the buzzword that you should focus on? Is feeling of restlessness. That's the key. Therefore, this patient has restlessness. Then I'll answer the question in 2 ways. Look at what I'm going to do. Assuming I have no idea what is Olanzapine, then I will say to myself, patient is on some medication for 8 weeks. All of a sudden, is feeling what? Restlessness. That's bad. Something bad. I mean, he just can't stay still. Walking around, can't stay still. Therefore, I know I need to do something about it. Then I tell myself, if I don't know olanzapine, I have to know one of this. Then when you look at this, phenoxine is monoamine inhibitor, MOIs. And what are they? They have the most notorious bad medication, antidepressant you can ever take. They have bad side effects. Therefore, a patient who is restless, I'm not going to give them a monoamine inhibitor, oxidase. There is no way I'm taking that one out. Then you know allopurinol is an antipsychotic. If you don't know at all, Aldol is the easy. Allopurinol is antipsychotic. I know they have bad side effects. I mean, there's no way I will use Aldol in a patient who is restless. There's no way. Unless you have somebody has agitation, is fighting somebody, we use it to subdue patient. But this does not look like this patient needs to be subdued. I take it out. I don't know olanzapine, but this clozapine look like olanzapine. Why would I give some medication that look close to that? I take that one out. And then even if I don't know this, I'm picking it if I'm taking the test. Now let's go with the content. You know, olanzapine is a second generation antipsychotic. An antipsychotic, they have what? Neuroleptic malignant syndrome, extrapyramidal side effects, they have weight gain, so many side effects. Inner feeling of restlessness, you know, if it's going to be neuroleptic malignant syndrome, they'll give you fever, hypertension, tachycardia, this patient inner feeling. Therefore, it sounds like extrapyramidal side effect. And that is ADAPT. Akathisia, acute dystonia, akathisia, Parkinsonism, and tardive dyskinesia. Which one is the patient showing? Is akathisia. Akathisia is the inner feeling of no moving around. You can stay around and you can stay still for a long time. Therefore, if you're taking second generation antipsychotic, I'm not going to give you something that look like a second generation. I'm not going to give you a first generation, which is allopurinol. And of course, if I have to choose phenoxine and benzodiazepine, I'm choosing benzodiazepine. The treatment for akathisia is a benzodiazepine or anticholinergic. That's why number 4 is the right answer. And that's the way to answer the question in 2 ways using content. And no idea if you have no idea about the question. I hope you got it. And then number 2, same strategy, right? Which of the following may indicate transplant rejection? A nurse is caring for a client who had what? Kidney transplant 3 years ago. Client was admitted with what? Fatigue and anorexia. Which of this will indicate transplant rejection? Think about it. To get a transplant, your kidney may have renal failure. When you have renal failure, you have what? Fluid overloaded. That's why you get dialysis. And we give you a new kidney, transplant kidney, to take away the dialysis so that you are not fluid overloaded. Definition of kidney transplant rejection, that means you have no kidney anymore. Therefore, you're back to having dialysis for the fluid overloaded. So signs and symptoms of fluid overloaded is consistent with rejection. I'm looking for anything that tell me I'm fluid overloaded. Lower leg edema, fluid overloaded. If your blood pressure is controlled, all of a sudden it's not controlled, worsening hypertension because you are fluid overloaded. When you have renal failure, you can pee. Oliguria means less than 500, 400 ml per day. So it's consistent with that. This is a concept, but if you don't know, leave that answer, number 4 alone. Just choose 1 to 3. When we transplant you, your kidney is on your back, the original kidney. We don't remove the original kidney and put the new kidney on your back. We put it on your groin area. So the transplant kidney is on your groin. That's where we put it. Therefore, when you have failure of the new transplant kidney, it gets bigger and it becomes painful. That's why you get groin pain. Your creatinine is not going to be normal. Therefore, this is wrong. So the right answer is 1, 2, 3, and 4. 1, 2, 3, and 4. Okay? We're just learning test-taking strategy, how to attack questions. This is the same thing. Which of the following client may be experiencing depression? And let's just receive training on symptoms of major depressive disorder. I'm just using words. What you need to do, the question is asking, what is depression? And you have to bring your content. If you don't know, this is the way to remember. Sigecaps. Sleep, S means sleep. Sleep goes up and down. I is your interest. Your interest go down. Guilt, he has no direction. You're just guilty about everything. I guess it goes up. Energy, it goes down. Concentration goes down. Your appetite go up and down. That's why you can gain weight or lose weight. Psychomotor agitation, you become irritable, so it goes up. Suicide ideation goes up. Therefore, you look in this and see if you meet this criteria. Weight loss, yes. Insomnia, you can sleep. Inertia, you have no energy. But worrying about everything is anxiety. So this take that one out. You gain weight because you're eating too much, you're oversleeping, you have no energy. Pressure speech is mostly bipolar patient. Weight loss, you're not eating, you're oversleeping, you have no interest, but you have excessive worry. Yeah, it can be. You gain weight, you can't sleep, you have no interest, and you feel guilt. You meet all the criteria. I'm just using concept. So 4 is your right answer. And this question, the child names as a new graduate. Next on the word, which client is appropriate for the new graduate? Whenever you have a new graduate, give them somebody who is what? Predictable outcome. I know what is going to happen to this patient, so I'm going to give it to you. Give them stable patient. Let's go through. A client with borderline disorder admitted 30 minutes ago. This is a trap question. If you don't think about it carefully, you pick number 1 as your right answer. Borderline patients are the most difficult patient to take care of. They split, they give you bad cap, good cap nurses. They create confusion in the ward, and you have to have multidisciplinary team to take care of this patient so that everybody know how to deal with this patient, what to do, because they're going to manipulate you, they create confusion, they'll give you headache. A new graduate is not ready for this. They split and they create problem. Even though they have no wound, nothing, they are the most dangerous patient you want to take care of because they will make your life miserable. A new graduate will be crying, will spend all day with that client, does not know what to do. And the bipolar patient would love to get a new graduate and manipulate them. Acute cholecystitis patient, what do you need for this patient? IV fluid, antibiotic, pain management. When you're ready for surgery, they go to surgery. They come back, just regular post-op care. There's nothing big about this patient. It's the same as diverticulitis or appendicitis. This patient look like a candidate. Patient with acute myocardial infarction, no way. New graduate will freak out. There's so many things you have to do. This patient will go into shock. We worry about it. So no. Cardiac catheterization. What is your number one problem with somebody who has cardiac catheterization? Hemorrhage, 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 and shock. New graduates will not be a good candidate for this patient. So the right answer is number one. I know it looks deceiving. It's deceiving. No, sorry. The right answer is number two. I know it looks deceiving to pick number one, but don't pick number one. The right answer is number two. Number one is not good for the new graduate. Pick number two because you have predictable end. Number one look deceiving, but don't pick it. Okay, once again, right answer. Number two, borderline disorder patient is too dangerous. Not in terms of hemodynamics or any other thing, blood pressure, but it's because of the way to deal with them. You got to be skillful and navigate their needs as much as possible. And the last question is all based on concept. And what is the concept? A nurse is caring for a client with the EKG strip below. Systolic blood pressure is 90, and the patient is diaphoretic. What is the next best action? First, to answer this question, read the EKG. After that, find the keywords. When you find the keywords, make the diagnosis, then go back to the concept and see what concept you need to answer the question. If you need and strategy on how to read EKG, I have a bunch of videos on Adapt NCLEX, very good one, too big, comprehensive one. The only video you want to watch for EKG, and you master it. So how to do it, check for RR interval and see if it's regular. If this is regular, the distance between one R to another R is regular, then you save. If it's not, there's only two things. I always want it to be regular so that I have two things to deal with. From here to here, it's not the same as distance from here to here. And from here to here, it's not the same. So I know this is irregular. I'm dealing with irregular rhythm. And there's two things. It's either AFib or you have a block. AV block, first degree block, second degree, third degree. This look like AFib to me. I don't see any block. I see a lot of P waves. I can count it. This is not sawtooth, which is a flatter, the flatter wave, because flatter wave, the rhythm is regular. AFib, the rhythm is irregular. Therefore, I know this is AFib. Then you go back to the question. The first thing, concept you need to know, whenever you have AFib, the number one thing you want to do is rate control. So don't worry about anticoagulation at all. AFib, rate control. Therefore, I know I'm not supposed to worry about anticoagulation. Coumadin is anticoagulation. Why do you give Coumadin? You check echo first to make sure there's no clot. So I take echo and Coumadin out. Now I have 1 and 2. I know I have to do rate control, but before I think about that, whether to give medication or fire, there's two ways. You give them energy to do rate control or you give them medication. You give them medication if their blood pressure is normal or they have no symptoms. So if there is no symptoms, then give them medication to bring their rate down. If they have symptoms, cardiovert them right away. This patient's systolic blood pressure is 90 and it's diaphoretic. It's symptomatic. Therefore, to rate control, I have to use electricity. And that electricity is cardioversion. And that is the way you answer this question. Take care of yourself. Thank you for watching this video. This is the 5 theories we've done. I hope you learned something of test taking skills. Good luck in your exams and all the best of luck. Bye.